Just do it quick.
Okay, I'm just getting into room right now.
All right. Come in. Hi, my name's Kristy. I'm your student nurse from University of Detroit Mercy today. I'm going to go ahead and close this curtain here for your privacy. Wash my hands for at least 30 seconds. All right. Could you please state your name and date of birth for me?
Matt Kennison, 12/6/87.
Okay, I'm going to check the patient's ID to make sure that that's correct. And it is, and patient does also appear to be his stated age. So Matt, do you have any signs, or do you have any pain today?
No.
Okay, and any allergies I should be aware of?
No.
Okay, there is also no obvious signs of illness at all. So I'm going to ask you a couple questions. Do you know who the president is?
Obama.
Okay, and do you know what today's date is?
Wednesday, June 15th, 2016.
Okay, awesome. And do you know where you're at?
UDM.
Right, okay, so the patient is alert and oriented ×3. He also, his appearance, he's very well groomed. I am not noticing any bad mouth odors such as acetone or a fruity floral, and his speech is also very clear, and his mood and affect are also congruent. Okay, so Matt, we're going to go ahead and get started today. I'm going to go ahead and assess his skin. I'm inspecting. I'm not seeing any lesions, but if I were to see any lesions, I would use the A, B, C, D, E mnemonic to evaluate them. And then next I'm going to go ahead and feel for the temperature of his skin. Okay, the temperature of his skin seems to be warm. I'm not noticing any type of moisture or anything like that. So now, starting with the face, his face is symmetrical, it's midline to his body. His skin is also appropriate for his ethnicity. And so I'm going to go ahead, Matt, and I'm going to have you just raise your eyebrows for me if you would. Okay, and can you puff out your mouth and smile? Okay, awesome. So his facial cranial nerve number 7 is intact. Okay, Matt. Now I'm going to go ahead and have you close your eyes. And can you tell me where on your face that I'm touching you at?
Forehead.
Okay.
Cheeks.
Okay.
Chin.
All right, so that's cranial nerve number 5, which is also intact. All right, so next I'm going to go ahead and move on to the eyes. Upon observance, his sclera is white. His pupils are round. I'm going to go ahead and pull down here on your face if you don't mind. Okay, and his conjunctiva is also pink. So I'm going to go ahead and turn off the light. We're going to go ahead and check your pupils for, reaction to light, okay? All right, go ahead and look straight forward for me, okay? Okay? Okay. So the pupils were reactive to light. Okay, Matt, and I'm going to also have you go ahead and follow this pen with your eyes, okay? Okay, so his pupils were equally round and reactive. Pupils were equally round, reactive, and accommodating to light. Okay. All right. Okay, so now I'm going to go ahead and I'm going to take a look inside of your mouth, okay?
Okay.
I'm going to go ahead and have you stick out your tongue. Okay, thank you. And can you say ah for me? Okay. So I did notice that his uvula was midline and it did react appropriately. Take another look inside. I'm going to look at your tonsils. Okay, his tonsils are at a 1+. His mucosa is nice and pink. I did not see a coating on the tongue at all. His teeth were white. Go ahead and just smile for me if you would. Okay, and his gums are nice and pink. I don't notice any cuts, any bleeding, anything like that. His teeth were white and aligned. All right. Okay, so next we're going to go ahead and I'm going to feel for his carotid artery. Okay. Okay, so they both would be, I would rate both of them at 2+, and now I'm going to go ahead and listen to them with the bellow of my stethoscope. Okay. Okay, I didn't notice any breweries present, So now what I'm going to go ahead and do is I am going to move on to the lungs. I'll start in the front. So first I'm going to listen to the lungs with the diaphragm of the stethoscope in 10 different places anteriorly. And while I'm doing this, I would also inform him to inhale and exhale. I would listen for the full in and exhalation. Listening for any type of abnormal sounds, any type of wheezing, crackling. That might have been 12, but that's all right. Okay, so now I'm going to also go ahead and listen to the side in 2 different places. And then we're going to go on to the other side as well. And then to the back for to listen 10 more times. Start up here. Again, listening for a full inhale and exhalation. So after listening to his lungs, I noticed that there was no wheezing sounds, there's no crackling, his lungs seem to be clear. Okay, so the next thing that I'm going to go ahead and listen to would be the heart. Okay, so I'm going to start listening to the heart with the diaphragm. I'm going to listen at all 5 spaces, which I will point out as I am listening to them. And then I'm going to go ahead after that, and I would listen to the apical heart rate and then come back up with the bell of my diaphragm. So the first place we're going to go to is the aortic, and that is located at the second intercostal space to the right of the sternum. And then from there I'm going to go to the pulmonic, which is the second intercostal space to the left of the sternum. And then we're going to come down to the herbs, which is a third intercostal space to the left of the sternum. And listen. And then I'm going to go ahead and come down to the tricuspid, which is in between the 4th and 5th intercostal space to the left of the sternum. And further over, which is more mid-clavicular, which is the mitral. When I'm down here, I'm going to listen for the apical heart rate for 60 seconds. And then after doing that, I'm going to go ahead and use the bell of my stethoscope. And I'm going to listen to all 5 spots as well, coming back up. Okay, and I was able to hear S2 the loudest at the base and S1 the loudest at the apex. Okay, so the next thing that I'm going to do is I'm going to go ahead and check Matt's spine. I'm going to start all the way at the top. And Matt, go ahead and let me know if there is any tenderness or any pain as I'm going down your spine, okay?
No.
Okay, so when observing this, I am looking to see if there's any S-shaped typed curve, and Matt's spine seems to be very straight, so I'm not noticing any abnormalities. Next, I'm going to go and I'm going to just pound on the back here. Just let me know if you have any tenderness, okay?
Nope. Nope.
Okay, so next I am, that was looking at the kidneys, and that seems to be normal as well. So I will look at his anterior and posterior ratio, which does seem to be a 1 to 2, so that is normal as well. Okay, Matt, so the next thing that we're going to have you do is I'm going to have you lay down, if you wouldn't mind. Then we're going to have you lift up your shirt as well. Okay, so I'm looking at his skin, looking for any types of stria, any types of tattoos, any piercing, any abnormalities. His skin seems to appear normal. I'm not seeing any scars or anything to indicate previous surgeries. His umbilicus is midline. Okay, so after that, I would go ahead and ask, are you having any abdominal pain?
No.
No, okay, so he said that he's not having any abdominal pain, so next I'm going to go ahead and listen for any bowel movement sounds. I'm going to use the diaphragm of my stethoscope to do that. Okay, so first I would start in the right lower quadrant, listening for any bowel sounds. If I don't hear any bowel sounds present, I would stay here for at least 5 minutes. And if I still don't, I would chart that and possibly go get someone else to see if maybe they can. But if I do hear sounds, I'm going to be able to move on to the next quadrant, which would be the right upper quadrant. Okay, and I do hear some tinkling going on, so I'll move to the left upper quadrant. There is some tinkling as well there, and the left lower quadrant. I'm noticing a little bit of tinkling, but kind of a little bit more of a swishing noise in the left lower quadrant. So after that, I'm going to go ahead and palpate. He said he wasn't having any pain, so, you know, Matt, go ahead and let me know when I am pushing down on your abdomen if you feel any pain, okay?
Okay.
To start with the right lower quadrant, I'm pushing down. Any tenderness, any pain?
No.
Okay. In the right lower quadrant is your appendix and his right spermatic cord. And in the left upper quadrant is his gallbladder and liver. Any pain?
No.
Okay, and any pain over here?
No.
Okay, so in his left upper quadrant is going to be his spleen and stomach. And then in his left lower quadrant, any pain?
No.
So that would be his sigmoid colon and his left spermatic cord. Okay, go ahead and sit up for me. Okay. All right, so next I'm going to go ahead and feel for the brachial pulse bilaterally. Okay, thank you. Okay, so his brachial pulse appears to be 2+ bilaterally. Now I'm going to go to the radial pulse. Okay, and that is also a 2+ bilaterally. So next I'm going to go ahead and inspect his hands. His hands, the skin appears to be normal and congruent with the rest of his body. His nail beds are nice and pink. There's no splitting of his nails. I'm not noticing any type of clubbing at all. I'm going to go ahead and I'm going to press on his nails. Okay, so his capillary refill does seem to be less than 3 seconds. Okay, Matt, now what I'm going to do is I'm going to go ahead and have you squeeze both of my fingers, okay? Okay, and his strength does seem to be congruent bilaterally. All right, so next I'm going to go ahead and I'm going to assess for any swelling or edema in his legs. Okay, there's no edema present. And Matt, would you mind just removing your shoes for me? Thank you. So next I'm going to go ahead and feel for the posterior tibialis pulse. Okay, I would grade that as a 1+. And next I'm going to go and feel for the dorsalis pedis, which appears to be a 2+. After that, I'm going to go ahead and test for capillary refill on his toes, which is less than 3 seconds, so we are good there. And then next I'm going to go ahead and do the Babinski test. I'm going to take the bottom of his foot, go along the outside, apply pressure around, and same with the other. Okay, so the Babinski test appears negative because his toes did not flare out at all. All right, Matt, so next I'm going to go ahead and have you stand up for me, if you wouldn't mind. And I'm going to have you walk 10 steps away and walk 10 steps back. Right now we are doing the get up and go test, and he seemed to have a very steady gait, and that would give us a negative get up and go test. And next we're going to do the Romberg test. So I'm just going to have you close your eyes, put your arms next to your side. I'm going to stand here with him for 20 seconds at least, up to a minute would be more appropriate, to test his balance. He seems to have a nice sturdy balance. You can open your eyes. I'd also be here just in case he didn't and he was falling, and I would want to make sure that I catch him and make sure he doesn't hit the ground. So that would be a negative Romberg test. Okay.